Welcome to the office.
Hi, Karina.
Hi.
Welcome to the office.
Thank you.
Where are you coming from?
Well, I'm Ukrainian, but I grew up in Israel.
Okay.
Yeah, and I've been here for a few years now.
Okay.
Yeah.
And how are you liking LA?
I'm loving it. It's great. Yeah.
Cool. What you doing here?
Well, here I am because of my spine.
Okay, we have a few things going on, right?
Yeah, when I was 11, 12, I was diagnosed with scoliosis.
Okay.
But back then it was not, it was not anything big or major. So
Was there a trauma? Like what sports did you do when you were a kid?
Honestly, it was not because of sports or trauma. I know my dad had scoliosis, so
Okay.
it might be genetic, but
Okay.
not sure. But back then it was just, you could tell there was a curve, there was an issue
Back
there.
when you
but
were
it was,
11.
Yeah, but
And
it was,
this is back in
that was,
Israel?
That's in Israel,
That's
yeah.
back in Israel.
Yeah.
And they said what? Just
So it wasn't that bad to do surgery or anything. So they just told me to do a physiotherapy, just maybe swim, it will go away.
okay.
But it never did.
Okay.
So the older I got, I started feeling the pain in my back.
Okay. And how was it affecting quality of life? Activities, workouts, sitting, studying,
Yeah.
working?
When I was a teenager, I didn't really feel it that much.
Okay.
But my early 20s, late 20s, I could definitely feel the difference. Like I could feel, I couldn't sit for a long time. I couldn't stand for a long time. Like this part of my back sort of hurt after.
Upper right part of your back?
Yeah, so because of that, my back is not even because of the scoliosis. So the one that's bulging out is the
Okay.
one that hurts.
Okay.
Yeah, and it's kind of like I can't work out for a long time. I can't stand for a long time. So, and I'm still young.
You're too young for all this. Okay. So we need to do the evaluation of your X-rays of scoliosis. How are we going to classify it? Number one, and number two, what is the management of it? Okay.
Yeah.
Is there anything else going on?
I wanted to address my jaw.
Okay.
It's clicking a lot when I yawn, and I yawn a lot.
Okay.
So
More right side, more left side, or both?
I would say more left side.
Okay.
Yeah.
And you've had that for how long?
So it actually started in the last few years.
Okay.
I mean, I do know that my jaw is it's not straight.
Okay.
So I was told I need to do surgery and all that, but
We don't want surgery.
we don't want surgery. So yeah, if there's anything that can be done to
Okay.
make it feel
We'll
better.
take a look at it for you. Feet, knees, everything else?
Looks.
Good.
I think it's good for me. Yeah.
Okay. So let's go over your X-rays.
Okay.
Let me explain what I see. We'll do the exam and figure out what we're going to do today.
Okay.
Sound good?
Sounds good.
Let's do it. This is a picture in time. This is a full spine X-ray. We're doing the evaluation and management of, is this true scoliosis or is this a curved spine? Okay. Now, this is looking at you from behind. This is the right side. This is the left side. This is your side profile. Okay. Now, first thing we're looking at is the foundation. Think of this, this is your 24-story building. This is the foundation of your 24-story building. And yes, there is a curvature issue here. Is this a true scoliosis? Not a true scoliosis. And I'll explain why.
Fake scoliosis.
It's a curved spine, okay? It's not a true, it's fake, okay? No, and we'll explain why it's doing this, okay? We'll get to that. On this X-ray, we're looking at your side profile. Do we have the right curvature? Forward curve, backward curve, forward curve. 60-60. Neck should be 60 forward. Some say as low as 40. What I want you to see on your posture overall is what? Let's forget this for a second. And the reason why is, when I have two X-rays like this, right? We have the AP and lateral. We have curvature in the spine. My real business isn't here. I'm not here to, let me straighten out the spine and hear me out why. When we're looking at both of these, if we have the right curvature on this X-ray, then whatever this is that patient's normal. But you don't have the right curvature on this X-ray. And what do I mean by that? This line, posture line from L5, should be going through the neck here. And what it's showing us is that you carry your upper body behind your foundation. So a lot of your muscle tension and all this stuff is because of posture. Okay? And that's what we're going to need to work on. And we're going to come back to this now. Let's go over to your foundation. Let's run this line. Now, the first line I put on this x-ray is this. And we're taking a line, we're running it from S1, which is the first sacral tubercle. We're running it straight up. And there's a little bit of good news here. If this line, okay, this is to say, has the body compensated? Is it a compensated curve or a decompensated curve? Compensated curve means there's no change that's going to happen. It's a functional management issue. A decompensated curve means it hasn't fully compensated. There is change that can happen. And when we look at your spine, we're running this. This should bisect the dens here of C2. And the fact that it doesn't is good news, okay? So the body has not fully compensated yet. That's the good news. We're going to come back to this. Let's now go down into the foundation and let's see, what do we see in her foundation? And could there be a cause? We can see, number one, that here's the tailbone. It's bent. And that bent tailbone, look, S1, S2, S3, down S4. This is S5 coccyx. So at S4 is where the bend starts. And here's what I want you to see. This is really important, Karina. Okay? I want you to see that that bend, watch, follow the cursor, goes up and it takes the whole thing with it. So the fix or any sort of correction is just focusing really on this down here on S4. Okay? We have a little bit of bend in the coccyx. We have S4 as well, both of them. So we need to figure out which one we're going to work on. Hips are good. You can see there's deviation of the pelvis away from the crease of the bum. And let's look at the numbers and what the numbers mean. Okay? So if we look at the numbers, what do we see here? We have a rotated pelvis and rotated sacrum, dropped 5 millimeters on the right. We have a slightly, now here's the challenge in her case. She has a bent tailbone to the left and a short leg to the right. If we work on the pelvis, we will make the leg length imbalance more. If it becomes more, then this curve becomes more. So the answer is not your pelvis. The answer is your tailbone for any sort of stability and correction. So this is going to be our focus here and here. Does that make sense?
Yeah.
It's a lot, I know.
Yeah, a lot of information, but yeah, I think
The gist of it is this. We have a bent tailbone. This was one of our initial traumas. That's one of the major causes, and we have misaligned pelvis. I can't work on your pelvis right now, okay?
I see.
Now, here's the good news. If we can get this sacrum up, okay, then I can work on the pelvis. Now watch this. If I adjust the pelvis, 3MD, we'll go to 8. But if the sacrum can come up, it'll go back to 3. Does that make sense? So the sacrum is down 5, but so is the hip. If I adjust your hips, it makes the hip go down more. So that's not our answer. So our answer is in here somewhere. Okay?
So we just start with the tailbone, and then when that's even...
Our focus, yes, our focus really is that tailbone, this bend here, not this. This is all compensation to the tailbone. Now let's go down. So you can see it curves. What I'm looking for right now, Karina, are there any bony deformities? I don't mean are there any bony changes? These are all normal bones, normal. Normal. The only thing that's a little bit off is this one right here. Let's count. This one right there. That one. 1, 2, 3, 4, 5, 6, 7, 8. Number 9. So number 9 looks off to me in terms of the shape of the bone. It's a little squished in there. The rest of them look fine. So T9 is a focus. T9, number 1, and your tailbone. Those are our 2 majors. Now in the neck, we can see a little bit of the jaw deviation from right to left. We can see that C2 is slightly up on that right side. So for the upper cervical and neck, we have a couple of things going on. I'm just moving this. We have C2 wedged up on the right. And we have the C1 wedged up on the left. So we have our critical atlas, we have T9, and we have our tailbone. That's our focus.
Okay.
Okay, and you're done.
Not a biggie.
Not a
just
big- just a few
a bunch
things.
of things.
But here's the thing, I don't see this as true scoliosis. I see this as
Okay.
curved spine from traumas that happened early on. That's how I see it. So whether family had it, whoever had it, I'm not seeing that in terms of the bony deformity in the tailbone. I see it as a trauma.
So you think when I was a child,
You had a
something
couple of
happened?
good traumas back then. Okay?
Maybe. Yeah, it could be. I don't remember.
You ready to get started?
Yeah.
Let's do it. And what she's talking about is this. You can see the musculature is a little bit more pronounced here. And that's the
Do you see
thing.
it now?
Now you see it more
Yeah.
that way, right? Okay, walk to the room and back a few times. We're looking at her tailbone, the dimples, and do they move up and down? Go ahead and walk, please. Back and forth several times. Keep going. How you like being in LA now?
Yeah, it's great. You know, I feel like I'm from LA already.
3 years?
Yeah, about 3.5 years.
Walk on your toes, please, up high. And you can see that the sacrum moves side to side, but she's not really getting the movement through the dimples. Walk on your heels. You can see that right side. It's just going side to side. Okay, come over here, have a seat. Let's get started. Starting at the base. And we're getting that upper cervical. C1, right side. C2, goes left, goes right, breaks there. All right. Bend forward, please. Touch your toes. Let's take a look at that curve. So let's look at it from the back here, please. Right? As we're following it up, you can see it. You lose the spine here. There's something going on in this area here. Then it jets off to the side here. So our T9 area here and our tailbone. Sit up, please. There it is. T9, T10 area. There it is. S4 down low, 12 points. Gotcha. Aquí, T9, and up top. Matches the x-ray a little bit there, yo. Next thing we need to do is let's check your hips. Scoot forward, feet together. Actually, scoot back a little bit. You got longer legs. Feet together. Open and close your knees with your feet touching. Okay?
Yeah.
General motion as side joints, right side only. When she does the right, the whole left wants to shift. Left side only. When she does the left, the whole right side wants to shift. So they're both stuck. Scoot back for me, please. Let's do static palpation. Head down, look down, round your back. So a couple of things in this Gonstead work, guys, when we're doing the evaluation. One is full spine analysis on an x-ray. There's instrumentation, that's what we ran. We found a few hot spots. Then we have static palpation. And in static palpation, we're looking for edema, swelling point, tenderness. And you can see as I run my fingers down the spine, that's where it starts to pool the edema. All there. Then it disappears. Okay. Then it starts up again down here. So 7, 1, 2, 3, 4, 5, 6, 7, 8, 9, More tender there.
Yeah.
9 or 10?
9.
9. Not 8.
Definitely 9.
9. Okay. Let's check the sacrum. Back slowly towards me, please. L5. S1. S2. Tender. Not too bad.
Not too bad.
S3.
A little bit more. Yeah, a little bit more tender.
S4. S4 on the left. S4 on the right. One more, okay?
Yeah.
S5. That's not too bad. Right there.
Yeah.
That one right there.
That hurts,
Between
yeah.
S3 and S4. Now I'm going down low on the outside. Not too bad. More tender here or more tender there?
There probably.
S3.
Yeah.
Okay. So we're going to do S3, S4, T9. Let's check up top. Sit back for me, please. Yeah. C2 on the right, C1 on the left. Turn to the left, turn to the right. Look up, turn right, turn left. That's divorce test. Look down, isolating the upper cervical. Yeah. It's tighter when we look down. Okay. Game plan.
Okay.
Game plan. T9, we're going to set on the knee chest table. 1, 2, 3, 4, 5, 6, 7, 9. So we got to come in on that T9 and we got to kind of push it in there that way, right to left. So let's do S3, S4 on the right side. And here's the challenge on her, okay? You can see the curve to the right here. However, we're adjusting down here, so we want to see based on that. And based on that, the high side is on the left, so I'm okay putting her right side down. We just got to pull that shoulder up to really elongate that spine for the sacrum. T9 we'll do on the hylo, and upper cervical we'll do on the chair. All right, let's do this.
Okay.
Sit back for me, please. All the way back. Right hand up. Seatbelt on. And down. Shoulders back. C2. I'm going to be a little firm there. There it is. A little firm. There. Drop that right ear down. Down. Gotcha. She's a tough one. I gotcha. She's tough. She's tough because she cracks her neck a lot back in the day. Self-crackers. Now for C1, we got to get that angle down there. C1.
Ooh.
She's tight. Let's go over there, please. Face down. She don't make it work for her. Slide down a little bit. Slide down. There you go. Turn your head to the left. 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 That's the right. That's the right. Left hand up. Left hand up. Slide up. Slide up. Slide up. Now she's a little flexible here. So what I want to do, bring your left hand here, please. There you go. I'm going to hold there with my fingers, just right there. There it is. Boom.
Ooh.
Gotcha.
Oh.
Ah!
Oh.
Head down, please.
You got me there.
I got you. Walk that off one space and we'll do your tailbone. Good times.
So I guess my main question is, if you fix the tailbone and then fix the pelvis, it will pull the spine straight?
It will give you a little bit straighter, yes.
Okay.
But remember, that's also doing the exercises and stretching out those ligaments, right? Because they've been like that for a period of time.
Yeah.
Let's go right side down, please.
But I don't need like a surgery or anything like that to. No, right? Okay, good.
I don't see that. Slide forward, please. Bottom straight, bottom leg straight, top leg is bent, look straight ahead. S3, we need to torque up. Correction. 1 second. Never mind, we're gonna do it 2 different, you're good. We're gonna torque it counterclockwise. 1, 2, 3. So I'm doing a pull, counterclockwise torque. I gotta stretch that shoulder out. You okay with that?
Yeah.
Okay?
Whoa.
Gotcha. Hold on. Go on your back, please. Yeah, let's stay on your back. Slide up. Okay, come on up. Let's go over here. Face down now. T9. There you go. T9. Alrighty. 1, 2. I want to set it a lot of lateral to medial. There. Drop the tummy. Gotcha. Gotcha. That's it. Come up slowly. That's the home run. Spicy.
Oh my god.
Spicy.
That was so spicy.
Spicy.
Okay, give me a second.
Take your time. Let's walk. Nice! Yeah, I got you today. Keep walking. 9 is also adrenals.
What?
And the T9 is also the adrenal glands, the fight or flight or stress button.
Oh, yeah.
Have a
I
seat.
have a lot of stress.
You don't have stress. Okay, deep breath in, all the way out. A little lighter on the spine right now.
Yeah. I feel like something unlocked.
So we're gonna do a series of tailbone adjustments with you, okay?
Yeah.
And after the series of tailbone adjustments, I'm gonna redo your pelvic x-ray. Got it?
Okay. Let's do it.
All clear. All clear. Check it out. Back towards me. Mira. 1, 2. That was the one. Different?
Yeah.
Yeah!
It's not that tender now. Was that because of that?
That's because of the tailbone adjustment. Okay, you're all set there. Ears. Center on the chest, please. Jaw time.
Oh.
Up. Open. That's that right jaw deviation. So we're going to do the right AI. Open all the way. Open. My thenas are on the condyle. And we're basically, as she's opening, we have to subluxate it a little bit more in order to get it back in. Open and close. Close. Open. Open. Slowly close. There you go. That's it. Gotcha.
Oh yeah, it's so tender there. Ooh.
5, 4, 3, 2, 1. Sit up straight. Shoulders over, around, over, around. That's it. On your back, please. Work on your feet. You did good today.
Oh my goodness.
Turn your ankle. Stick a fork in her. She's dirty. Come on up.
I cannot.
Come on up. Walk it off one last time, please.
Alright.
Or 2 times. Shake it off. As you're walking, tell us if anything is different for you right now.
Yeah, like you said, I definitely feel a little bit lighter, not that heavy on my back.
Okay. Squeeze, squeeze, squeeze. Elbow, wrist. Squeeze,
Didn't know I needed that.
squeeze. You get a nose job next time. Lose the rings.
I need a nose job.
I'll give you a nose job next
I need a
visit.
nose job.
Relax there. There you go. Squeeze. Squeeze. We're all set.
Okay. Thanks.
You're welcome. So what we're going to do is let's follow up in about 2 weeks. Okay? Get your movement, do your Pilates, yoga, everything
Yeah.
you're doing. No weights though.
No weights.
And I'll figure out a series for you. Okay?
Sounds good. Thank you.
Welcome back.